let us cover the obturator hernia in this module. So it is also known as old little old lady hernia. And it is a narrow defect, most commonly seen in elderly, multiparous women. Elderly multiparous woman. Fine. And clinical features are pain and bowel obstruction. Fine. Then it occurs through a small opening, a narrow defect through the obturator foramen. Narrow defect through obturator foramen. The risk factors are because it is an elderly multiparous woman. There is a weakening of the pelvic muscles and the ligaments, and increase in abdominal pressure. And because it is multiparous, then she probably has got multiple previous surgeries. So these are the risk factors of this obturator hernia. Then we have got the pain and bowel obstruction and discomfort are some of the features. Diagnosis is like we can do that via MRI and CT. Then the repair is hernioplasty. Management is hernioplasty. Fine. The see what are the complications of this hernia. Complications is like there can be strangulation, or there can be a Richter's hernia. Richter's hernia is a type of hernia where one side of intestine protrude through this obturator canal, and rather than the entire width of the intestine, only one part of intestine. Fine. So what are the signs of obturator hernia? Signs are A. Horsip's Romberg sign. Horsip's Horsip's Romberg Horsip's Romberg sign. What it states? It states that the shooting pain along the obturator nerve on abductions and the adduction. Abduction is like the normally the legs are like this. If it gets like this, then it is abduction. Abduction and medial rotation of a hip. Abduction and the medial rotation of the hip. This is known as on abduction and the medial rotation. There is a shooting pain along the obturator nerve. Pain. This is known as Horsip's Romberg sign, and the other sign is Huntington's Giff sign. Huntington Giff sign. Huntington Giff signs states that it is patellar reflex positive, but adductor reflex is negative. Patellar is positive, adductor is negative. Patellar is positive, adductor is negative. This was our Huntington's Giff sign. Patellar reflex is, we already know that it is a type of a stretch reflex in which the patellar tendon is tapped or struck. This leads to which activates the muscles of quadriceps femoris and causes extension of the leg. Fine. This was patellar reflex, and adductor reflex is here is what happens in adductor reflex. Let us discuss. The adductor muscle is stretched by the sudden movement, which means we are adducting, and this stretching activates the muscle in the adductor magnus muscle, and the activated muscle spindle sends a signal to the spinal cord. The spinal cord responds by sending a signal back to the adductor magnus muscles, causing it to contract. Fine. The contraction of adductor magnus muscle causes the thigh to adduct. So this was our adductor and patellar reflex theory. Then Horsip's Romberg sign and Huntington Nif sign. How are we going to discuss? Obturator hernia is also known as little old lady hernia, and it is most common in the elderly multiparous woman. So, what are the risk factors of this hernia? Is like if the woman is elderly and has undergone surgeries and the weak pelvic muscles and the ligaments, then she is more prone to have this hernia. Then the features are like pain and up, bowel obstructions. Now, what happens is there is a narrow defect through what happens actually is there is a narrow defect through the obturator foramen, and we can manage it through hernioplasty. Complication is the strangulation and the restores hernia. Then what are the signs? That is Haussig-Stromberg sign and Hannington's Neff sign. Rossip's-Homburg signs and Hannington's Neff sign. Rossip's-Homburg is when there is adduction and internal rotation of the hip. Then this causes pain due to the obturator nerve, and Hannington Neff is patellar positive, obturator negative.